started this uh, establishment in the year 2001 in a very small clinic across the city. And gradually, with the success of that small clinic, we tried to expand it, and in the year 2004, we came to this premises where we are currently practicing. And since then, that is the year 2001, my aim was to be associated with academics. So I was in a continuous teaching job with various dental colleges. And the reason for that was to keep myself updated on the recent and current procedures and the recent advances which are happening in our dentistry. By teaching, it is not only that I am teaching somebody, but we learn, we tend to learn, and we keep reading a lot. And we get quite, and that is the reason I pursued that teaching career from that year so till now. It's been like around about 17 years now. I am right now heading Department of Prosthodontics in an institute here, Dental Institute. Apart from that, 17 years, it is not that I graduated and then I post-graduated in the subject of prosthodontics, crown and bridge, but I have been updating myself with newer techniques like in the field of implantology, in lasers. I have done certified courses in implantology in most of the places, been to Germany, studied there in the University of Dorset for a 6 months diploma. Then been to Pune, learned about basal implants, and educated myself with the newer form of implants which have come into dentistry recently. Then there were lots and lots of aesthetic courses, which was not only done by me but my other staff also, and my wife, who's also a co-proprietor of this establishment, has been educating herself in the field of cosmetics. At Pooja Dental Care, our motto is not only to treat patients, but to give them a genuine insight on what is going on in their mouths, what is essential for them. In dentistry nowadays, I see various clinics, they will all offer best of treatments, they will advertise best of treatments. But what treatment is important? We try to avoid unessential or unnecessary treatment. In this era of commercialization, I feel that a patient should get a genuine opinion and he should be genuinely treated. It should not be unnecessary treatment rendered for the sake of rendering those treatments. So our motive is to provide them with the genuine treatments. As far as talking about my own specialty, prosthodontics is a branch which deals with artificial replacements of the oral structures. It can not only oral structures, but we even deal with oral and maxillofacial structures. Maxillofacial, if I explain it in a simple language, it is like even replacing an artificial finger, or maybe an artificial ear, maybe an artificial eye, which may be an aesthetic proposition, may not give you the function, but it can naturally improve the aesthetics of a person. And we have been doing this not only at our clinics but at the institute where I'm working, and we have done number of cases where psychologically patient has upgraded after receiving such prosthetics in that manner. Mainly the cases which we get at our clinics are about artificial replacement of teeth, and artificial replacement of teeth means maybe fixed teeth, dentures, metal dentures, flexible acrylic dentures, and even dentures over implants or fixed teeth over implants. So this has been our speciality. Nowadays we are doing improved forms of implants where we don't even take much time in replacing teeth. We hardly take 3 to 4 days, and the patient can go off, eat whatever he wants, and can go on maintaining his teeth in the similar manner as his natural teeth. As far as cosmetics is concerned, 15 minutes a black tooth can be turned into a white one. Maybe half an hour a ceramic laminate can be placed over a patient's tooth, and patient can walk off looking completely different. And this we've been doing for last so many years. With the coming of newer materials and good labs in our country, we have been associated. For example, we've been associated with most one of the best labs in India, which is in Kerala, and we do regularly give them that work, and they have been very forthright in serving us for the last approximately 10 years. We've done thousands of crowns, inlays, onlays, laminates, all aesthetic work with them in the last 10 years, and they within 3 to 4 days we are able to get those crowns and ceramic veneers, and it's been a wonderful journey. My aim is to go in a similar manner, expand this establishment to a more big level. I even intend to start some courses where I can teach my students who still need more exposure towards the newer techniques, and I hope, which we will be, I think we'll be doing it in a very short while.
I am R.L. Dudeja. 4 or 5 years back, I had problem with my teeth towards evening, and I could not go to RR where I normally go. My wife suggested I visit Pooja Dental, and I found it's a beautiful clinic as good as we have in the army. I found the doctor also good hand, understood my problem, and for the last 5 years I have been coming here quite regularly whenever there is a problem. Most of my implements in the mouth are done by him. One of them is quite longish. In first attempt it was done beautifully. At 80 plus I am able to eat quite well, thanks to Salil.
Here at Pooja Dental Care, we are doing a lot of aesthetic as well as cosmetic treatments. Like we have patients, girls and boys, young girls and boys who are, going in for marriage or maybe some modeling assignments or some kind of other, aesthetic plans which they have for themselves. They want some kind of refinement in their looks and they want to get their smiles designed. So we tell them that we have so many other options like bleaching, like cosmetic veneers, porcelain veneers, cosmetic laminates, composite laminates, and we have porcelain laminates. But they don't understand all kind of these technical languages. So like we have to explain them that जैसे कि आप कपड़े को ब्लीच करते हैं तो हम यहाँ पे दांतों को आपके ब्लीच कर सकते हैं एक ही सिटिंग में, जिससे कि आपको अपने दांतों का जो शेड है वो 1 से 2% लाइटर नज़र आएगा. तो इससे कि उनको बहुत सारा पॉजिटिवनेस मिलती है एंड दे वांट टू गो इन फॉर दीज काइंड ऑफ ट्रीटमेंट्स. एंड देन वी एक्सप्लेन देम द टाइम टेकन फॉर दिस एंड what results would it bring to their smile and to their looks. Like we have young girls who are about to get married and they come up and they say that हमारे दांत या एक दांत मेरा टेढ़ा है या मेरा ये दांत का कलर अच्छा नहीं लगता मुझे, तो आप इसके लिए क्या कर सकते हैं और कितनी जल्दी कर सकते हैं, क्योंकि मेरी शादी 15 दिन में होने वाली है, तो मैं क्या 15 दिन के अंदर अपनी स्माइल चेंज कर सकती हूँ. So then we tell the patients that yes, of course, why not? Like you can go in for a in-office bleaching treatment, which can lighten your tooth color by almost say maybe 25 to 50%. That depends upon the defect, in fact, because patients don't realize this thing. They just want कि हमारा दांत का जो रंग है वो चेंज हो जाना चाहिए, एकदम से बिल्कुल जैसा है उससे बिल्कुल वाइट हो जाना चाहिए. लेकिन वी एक्सप्लेन देम दैट ऐसा हमेशा नहीं हो सकता, क्योंकि हम भी जब whenever we start doing a treatment, we don't know what result exactly we'll obtain after the treatment is over. So we try to explain the patient, we take them into confidence, and then we show them some kind of videos and pictures what we have of the treatment prior to the treatment as well as post treatment. So that gives them a lot of confidence, and then they are convinced to get a particular kind of treatment done for themselves. Now we have children also coming, small children. They have many habits which they start doing at a very young age, like thumb sucking, and sometimes children have habits like tongue thrusting. So we have various kind of appliances which we can give to such kind of children, which can help them leave their habit and get their tooth alignment in a normal and a natural way. So, but of course, children are a little difficult to deal with at times. So we have to convince them with certain kind of, probably some kind of videos, some kind of short movies or stories. We can tell them and we can explain them, we can show them their faces in the mirror, that how you look like now, how do you look, and probably how you could look if you leave these kind of habits, and you like try to understand that this is not good for you. I feel that the younger generation is much more inclined towards getting their smile designed, and they want to look good. And in fact, nowadays we have seen that even older people also are wanting to go in for aesthetic as well as cosmetic dental treatment, because the times are changing now, and everybody wants to look good. So we offer even ortho treatments for a slighter older group of people as well. Like we can do ortho treatment for even at the age of after like 20-25 years as well, depending upon the growth of the jaw and the bones and of course the structure of the face. So accordingly we can plan some kind of treatment for these kind of people also. Like talking about older segment of patients, we have like categories starting from, you can say, like from 35 to 50 years of age, or maybe more than that. We have a cosmetic and aesthetic treatment for them also. We have treatments for diastema closure and spaces which generally people complain of with the growing age. They come up and they say कि हमारे दांतों के बीच में gaps बढ़ते जा रहे हैं, तो इनको हम कैसे बंद आप कर सकते हैं, या आप इनको हमें कैसे आप ट्रीट कर सकते हैं. So we have various options for these kind of patients as well. We have we can give them crowns, and we can even cover these gaps with composite fillings, or at times with some composite or porcelain veneers also. So it's just that you have to take the patient into confidence, and you have to explain the right kind of treatment and the treatment modalities and options which are available, so that the patient has time, and he has a variety to think about, so that he gets convinced and he is confident that he will definitely get a beautiful smile once he goes out of the clinic. So that's all I can talk about these kind of treatments, and we are aspiring and we are hoping that we are able to fulfill what our patients expect from us, and they are they want that we should give them a good smile and a beautiful smile once they are out of our clinic, and everybody appreciates that once they go out, and they can achieve whatever they want to, wherever, in whichever field they are going in, like young students or young children, or even people who are going in for professions like modeling, or maybe some other designing and all, like fashion designing and all these things. Nowadays everywhere you need a beautiful smile and a good look. That is very important. So I think smile designing is one of the most essential part of our treatment and our clinic. It's one of the main aims I think we can achieve by giving a beautiful smile to each and everyone who comes to our clinic.
I'm Shagun Gupta, and I stay in Sector 15, Faridabad. I had this terrible pain in my tooth from last 15 days. I've been to so many dentists in the city, but then one of my friends suggested me Pooja Dental. I came to this clinic, I met Dr. Pooja, and she told me the whole procedure which was required. She's not only a very good doctor, but a very good person. Now we are more than friends. My experience in the clinic was perfect, and I'm really thankful that I came to this place. I would suggest this clinic to everyone.
My aim is not only to treat patients only at Pooja Dental Care, but my future plans is to educate the younger lot who are coming to the field of dentistry, to make them more educated in the newer techniques, and so that our dentistry remains in safe hands in our country, and probably the kind of advancements we are going through with our branch keeps going on further.